Hey everyone, I just wanted to do a quick video on the next assignments coming up, which is daily objectives and nursing report forms. So go to modules, and then this week is week 6. I'm going to click on here, and here is our daily objective form. I already downloaded it, and here is let me move that out of the way. Here is the Kapudi competency schedule. Okay, there. Now let me bring back this form. So on this form, the students should be writing 3 objectives. So if I show you back here, see how there's 3 Kapudi objectives for this week. And I tell the students 1 line so that this piece of paper can be on one side, 1 page. Because what the student is going to do is they're going to turn it into you on Canvas the night before by 8 p.m. So they get a little prep before they go to clinical the next day. And then they print it out. They print it out and bring with them on the day of clinical. And then when they get paired up with their nurse, the nurse turns to them and says, "Hi, how are you? Who are you?" They introduce themselves, saying it's their first clinical rotation, and here are my objectives of the day and what I can and cannot do. Now, the nurse probably is not going to take this from them, but just totally fine. But it shows the students in general what they can and can't do with on the unit. So you have to pass meds only with the instructor. Remember that. Only with the instructor can they pass meds. And then down here, what they can't do at all. They no IV medications, and we don't care for COVID or airborne isolation patients. That is part of our policy at Cal State Fullerton. All right, so they print this out, they bring it, then they show their RN, and then at the end of the day, they write a reflection. They can just turn it over and write a reflection. Now, you can collect these, you can talk about their clinical objective and reflection in post-conference. I'm not going to micromanage how you do that. However, please grade it in Canvas so that so the student always knows that they're up to date with their grading. Okay, so here's the deal. Um, the students no longer have the Kapudi textbook because we lost the grant funding and we're trying to have them save costs. So they really just checked out the Kapudi book from us last semester when they learned these competencies. So what I did is I embedded in here a little tickler of what the competency is. So what is determining important information to collect? Here's a little guide for what that competency is. So they can click in there as a little reminder. I love scanning the environment. I love that one. It's my favorite, I think. Scan your environment. How'd you get in there without your isolation stuff? There's the isolation cart right there. You walk right past it. Anyway, they make me giggle. Okay, so then back to the other part of this assignment is each week they are to complete their nursing report form. I do firmly believe that turning in something every day wrangles their mind to put things together because without turning something in, they're really not going to pay attention to their one patient. They're going to be paying attention to 4 patients that their nurse is running around taking care of. That is too much information. We want the students to kind of focus on one patient. Of course, they can still go around and see the other patients. That's good learning stuff. But they really need to start putting one patient together and feel the pain of documentation because they'll be complaining. It's like, I have so much paperwork. It's like, okay, just to let you know, the nurses have a lot of documentation. So it is a good transition to practice. On the flip side of this is the MAR. So they're familiar with this from the Marvin Stewart. So when they are passing meds with you and the patient, they have to fill out everything. Unless they have a drug card, right? They can say per drug card. What I say if they are not passing meds is they need to list the meds that their patient got on their shift, but very limited information on here. So drug name, classification, not just antihypertensive. I do require beta blocker or ACE inhibitor or calcium channel blocker. They should really know the pharmacological classification and why the patient is taking it. I train them in my clinical group, and also we were talking about it in the theory, is that here you wouldn't just say, oh, it's to lower your blood sugar. That's what that med does. But why does your patient need their blood sugar lowered? That's really the reason that the patient needs that medication. So, again, on this one, personally, I have them turn it in each week and I look at it. I do feel when they have to actually turn it into me and I'm going to be looking at it, they do a little bit more critical thinking and pay attention to putting the pieces together versus by not collecting it. But however you want to manage this, are you looking at it and in your mind's eye are saying that, hey, you did a good job. You're doing that in post conference. So at least you're getting your eyes on it. So if you don't fully collect it, please make sure that at least you're scanning over them and giving them a little bit of feedback. Remember, each week, I know it gets a little daunting, but I try to make it easy that you can just click, click, and submit for their grading. So we should be staying up to date with our grading. Our policy is within 2 weeks, if not shorter, because even for my personal self, I get like stressed out when there is outstanding grading to be done. I just want it off my list. Okay, I hope this was helpful. Thanks.